About 4,000 women in South Africa die every year from one of the most preventable cancers, cervical cancer, with young women 15 years or older being most at risk. Cervical cancer is the most prevalent cancer amongst women in the country, but it shouldn't be were it not for too many young women being diagnosed late, and there are reasons for that, which we will discuss in a moment, with the manager of the cervical cancer program at Right to Care, Dr. Bridgette Goeieman, who joins us to discuss how we can help prevent and treat cervical cancers, because there are many ideas out there that those numbers can be reduced. Doctor, pleasure to have you with us on the program.
Absolute pleasure. Thanks for inviting me.
Much appreciated. The number that I mentioned is around 4,000?
Yes, that's the death rate from cervical cancer.
Yeah.
However, in terms of the prevalence, in terms of how common it is,
yes,
we're diagnosing 8,000 cases every year in South Africa.
8,000
And
cases.
of those 8,000 cases, 4,000 die from the cancer.
Wow, so 50%.
50%.
And it
yes.
shouldn't be that diagnosis should not be a death sentence, basically, right?
It shouldn't be, Tom, because it's a highly preventable cancer, if not the most preventable of cancers. Yes. So in terms of how it's acquired, it's related to behavior. So if we preach how people should conduct themselves sexually, how they should protect themselves, then clearly there'll be a form of prevention against acquiring the infection that causes cervical cancer.
Right.
The cause of cervical cancer is actually a virus called the human papillomavirus, and this virus is sexually transmitted. So, contrary to popular belief, that's the commonest sexually transmitted infection amongst all the sexually transmitted infections. So unfortunately, people are not aware of that because there's a lot of publicity around other diseases like HIV, gonorrhea, and so forth. So the commonest of them all is HPV. And because there's so little knowledge around the subject, people don't really take it seriously. And we all know that, people die for lack of knowledge. And that's basically the main cause of people succumbing, is that they're not aware that they're actually carrying this virus and that it's causing damage to the cervix. Sure. And eventually it causes cancer.
All right, I'll be moving around the treatment and prevention interchangeably, so yes. I hope it's okay. Now, I said, and it's based on the background material that I came across and I read, that late diagnosis is very much a serious problem.
Correct.
Why is it a problem in that way? I mean, and how does it relate to treatment, in other words?
Okay. So people present late simply because they're not aware of the fact that they have the disease. And the reason for that is that it's a cancer that doesn't have symptoms in the early stages. Sure. So often women are not aware that they actually have cancer of the cervix up until they start presenting with symptoms such as bleeding from the vagina. They may complain that they're having pain when they're having sexual intercourse. So other signs would be if you have constant lower back pain, a watery discharge that smells very bad, and just generally weight loss, lack of appetite, and just a feeling of not being well. And
that would be, well, because there would not have been symptoms, so the disease will progress to that extent.
Correct. And you wouldn't be aware that you actually have the cancer up until you present yourself for a screening test, which we call the PEP test or the PEP smear test. And that is the only way, unfortunately, where we can pick up or detect the cancer. And that is why government has actually given us certain time intervals in one's lifetime as a woman where you should present yourself for screening, irrespective of whether you've got symptoms or not. And there are two categories of women that we have different guidelines for. So for the HIV negative patient who's otherwise well, we start screening from the age of 30. So when you turn 30, you should actually present yourself for your first pap smear. And then if that pap smear is normal, the next one would be 10 years later at the age of 40. And if that one is still normal, the last one would be at the age of 50. The reason for that long interval is that it's a very slowly progressive cancer. So we tend to pick it up and we can actually prevent it from spreading. And so when you screen for it and there are early signs that you might be developing a cancer, it can be treated. The other group of women would be the ones who are HIV positive. And for them, it's more frequently. So if you are HIV positive, regardless of your age, and you are female, the minute you test for HIV, you should then have a pap smear as well.
Okay.
And the reason for that is that HIV is actually an accelerator of the cancer in women. So if a woman is HIV positive, she should immediately have a pap smear test, because then that will indicate to her whether or not she's got abnormalities on the cervix that would then need treatment. But if that pap smear is normal, then we repeat the smear every 3 years. So it's 10 years for HIV negatives,
sure,
and 3 years for HIV positive.
I want to go back to from an individual's perspective, right?
Correct.
And then work it into the families and then the broader community.
Yes.
My next few questions. What should young women know, those who are still in their teenage years? So at what age should they go for the tests?
Okay, great. So the first thing that they should know is that this being a preventable cancer, the first form of prevention is a vaccine. So there is a vaccine that is available.
Yeah.
Unfortunately, it's a very expensive vaccine. So if you don't have a medical aid, it's quite expensive. So you would then have to get it in the public sector. And currently, government is rolling it out for girls who are in grade 4 or who are 9 years old. So if you have a daughter, have her vaccinated. And I'd also like to say to parents that when forms come from schools for parents to sign consent for their children to be vaccinated, parents often have apprehension and misgivings to say, I can't sign this form because they're planning to actually give my daughter contraception. But it's not a form of contraception. It is actually a primary form of prevention. So young girls should know that there is a vaccine to actually prevent themselves from being infected with the virus in the first place.
Whether from the public sector or the private sector.
Yes,
so if you're a parent, for instance, and you've got young daughters and you can afford it, take them for vaccination.
Yes. So in the public sector, it's currently only available for 9-year-olds or children who are in grade 4.
Sure.
So government is rolling that out en masse.
Yeah.
Then in the private sector, you can have it if you are between the ages of 9 and 26 and you haven't been sexually exposed or sexually active. You can then present yourself at any age. But for the teenagers, we're saying between the ages of 9 and 13, that's the ideal time to go for the vaccine.
Okay. But now, then there's the problem of cultural, traditional beliefs
Of
that,
course.
you know, what do you mean that the young person should be taken for vaccination or, you know, so...
I'm grateful for that question, Tim, because the very way we take our small babies to clinics to be vaccinated, it's exactly the same thing that we are doing in this instance. I think the fact that it's sexually transmitted creates that sort of apprehension around this being suggestive of sexual behavior that is irresponsible. We're not saying that children should be vaccinated so that they can go out and have unprotected sex, but we are saying that there's a reality that there is a virus out there that is sexually transmitted and that can be completely prevented if we just did what is needed to be done. So the vaccine is available and we should be vaccinated.
Now, you mentioned something about pap smears at
That's correct.
age 30 or what? Let me just understand. When should women go for those?
So firstly, the vaccine is the primary prevention. Then secondary prevention strategies would be the screening, then the pap smear test. So once you now have been sexually active and you are age 30, then you should go for your first pap smear, okay? That's considering that you are HIV negative.
Yes.
So, and if that pap smear is normal, your next pap smear would be at the age of 40 and
so
then another 10 years, yes. So for the HIV-infected person, the woman who's HIV positive, it's different completely.
Sure.
She should immediately, when she tests positive for HIV, also then have a pap smear at that time.
Let's talk about the available treatments then of the cancer or of the infection. Are there treatments available and what form would they take?
Yes, so...
Or maybe before I get to the treatment, just let's pause for a while so we can help our viewers. Now, the kinds of symptoms that they should be alerted to, can you talk me through those?
Yes. So as I've indicated, in the early stages, there's absolutely no symptom that there's something wrong. And then in the beginning stages, as you're progressing on to a more advanced condition, you will start having bleeding. So that would be the first sign that there's a problem. Bleeding randomly in between your normal periods, there would be a bleed. In the older woman, it would be once she bleeds when she's menopausal. What do I mean by menopause? It's a time in every woman's life where she no longer has a period. So if for some reason you suddenly start to bleed during the menopausal period, then that's a sign that there's definitely something that needs to be investigated. If you have pain during sexual intercourse, so whenever a woman has sex with her partner and that is a painful experience, it shouldn't be painful, then that needs to be investigated. Along with that would be a bleed as well. So if you're also bleeding after sexual intercourse, there should be an investigation. Patients will then also complain that they have a discharge that's just constantly flowing, that's very foul smelling. It smells very badly. It doesn't respond to antibiotics. So that should alert you as well that there's something wrong. Sometimes chronic back pain, you know, we often tend to ignore back pain because we're thinking, it's arthritis, and we attribute it to other things. But commonly, you know, backache can be a symptom of other things that go on. Sure. Then they'll also complain of pain in the lower abdominal area. So there'd be lower abdominal pain that is constant, and it gets worse as time goes on. The pain progresses.
But now let's assume you go for a woman goes for pap smears and so on, and then they detect that you may have contracted that virus. The treatments are there, I suppose.
Correct.
Yeah, tell me about that.
So the advantage of doing a pap smear is that when we pick up something abnormal early, we then treat the pre-cancer part of it. There's a treatment that we call a LEAP procedure, which is basically just removing the abnormal area on the cervix without taking out the cervix per se. And then once you have cancer, we then have to be more aggressive with the treatment. So the treatment will depend on the stage of cancer that you have. So when the pap smear comes back as abnormal, you are then referred for what we call a biopsy. So the biopsy is just a sample that we take from the cervix to confirm that indeed the pap smear has indicated or has alarmed us to something abnormal. So we will now want to confirm the diagnosis. Once that is confirmed that there's definitely a cancer, we then do what we call clinical staging. So we do like X-rays, we do sonars on the abdominal area to see how advanced has this cancer grown. So if it's confined to the cervix, then it's still a stage 1 cancer. We then just completely remove the cervix, and that's called a hysterectomy. So even that operation, you know, people are very scared of it because they tend to think that it's literally the end of their lives. And cultural issues also play in there. Then if it has spread to beyond the cervix, in other words, into the vagina now, then now you have what we call a stage 2 cancer. And for that, we also would then remove the womb, but we also then offer you chemoradiation. And a stage 3 would then be if the cancer is spread next to the cervix and next to the womb, which is called the pelvic area. So that is a stage 3 cancer. For that, we also treat with chemotherapy, radiation. And basically what radiation is sort of an X-ray kind of treatment where we actually shrink the tumor so that we can then actually cure it in that way, or we can also have it removed afterwards. Chemotherapy is also a treatment, medical treatment, of actually treating the cancer. Then the final stage of cancer is stage 4 cancer, where the cancer has now spread to other parts of the body. That's the unfortunate stage where, unfortunately, most women present at that stage of the cancer, and it has now spread to other organs. We can't operate on it. Chemoradiation is not going to be effective.
But I suppose the key word here is that it's prevention. Correct. And then early stages of detection so that you can be helped. That's the key message here in this interview. Well, Dr. Goeieman, much appreciated. Thanks very much for taking time to come and talk to us and help us learn and understand and help our viewers also learn and take care of themselves. We appreciate that.
Absolute pleasure. Thank you so much.
That's the manager of the cervical cancer program at The Right to Care, Dr. Bridgette Goeieman, and she was here to talk to us about the treatments and preventions available to dealing with cervical cancer.